Sexual health after a hysterectomy is an important aspect of a woman's overall well-being that deserves careful consideration. Where the effects of a hysterectomy on sexual health can vary widely among individuals, influenced by factors such as the type of hysterectomy performed, whether the ovaries were removed, the reasons for the surgery, and the individual's pre-surgery sexual function and overall health. Some women may experience improvements in sexual function and satisfaction due to relief from pain or bleeding, while others might face challenges.
Hysterectomy is a procedure wherein the uterus from a female body is removed. It is done by three major approaches: abdominal, vaginal, or laparoscopic. Scientific data concerning that how would hysterectomy actually affect a woman's sexual life is quite conflicting. We have almost 20% of the patients coming back to us after hysterectomy telling us that the sexual pleasure after hysterectomy has severely gone down. The reasons for this is when we are removing the uterus from a female's body, we are cutting the nerves surrounding the uterus, which are important for a good sexual life. Apart from that, we have also seen that there is decreased libido, there is vaginal shortening, there is increase in the vaginal dryness, and all of these can be contributing factors which can cause a reduction in the sexual pleasure after hysterectomy. However, contrary to this, we have seen that when women are undergoing hysterectomy for reasons like heavy menstrual bleeding, or say for pelvic pain, for women who have had painful intercourse, for women with painful periods, now because you are alleviating all of these factors, the bleeding is gone now there's no pain, these women usually report an improvement in the sexual life. So there's no particular data telling us whether there'll be improvement or decrement in the sexual pleasure after hysterectomy.
A hysterectomy, the surgical removal of the uterus, can have significant effects on a patient's body image, which in turn can influence their sexual health. Not to deny, changes in body image can profoundly affect sexual health. Negative perception of one's body can decrease sexual confidence and desire, leading to a reduction in sexual activity or satisfaction.
Talking about sexual health is still a big taboo in India, and especially women who are undergoing hysterectomy are in the perimenopausal age group. So these age group people are usually very hesitant talking about their sexual life, and I believe that undergoing a major surgery like hysterectomy do pose a lot of mental stress over them, and that in turn depletes their sexual life, especially in women who are undergoing hysterectomy for cancer. Cancer in itself reduces their self-body image, and that causes an impact on their sexual life as well. Also, I have seen that women who have had a previous psychiatric disorder, like women with depression or anxiety in the past, even they do not cope up with this quite well.
Hormonal changes following a hysterectomy, particularly when the ovaries are removed, can significantly impact sexual health. The ovaries are the primary source of estrogen and other hormones that regulate sexual function and overall well-being. When the ovaries are removed, it induces surgical menopause, leading to a sudden drop in hormone levels.
Ovaries are a reproductive organ which are important for formation of very important hormones like estrogen and testosterone in our body, and these hormones are important for your libido, for vaginal health. And once these ovaries are removed, they are definitely going to impact the sexual life. Ovarian removal is done especially in cancer patients, wherein you do it along with the hysterectomy. Apart from this, in some non-cancerous conditions also, ovaries are offered to be removed in patients wherein you don't want a future pathology in ovaries, especially in women with perimenopausal age group. You're removing the hysterectomy, so you concomitantly offer the patient that okay, we'll be removing your ovaries also, so that you do not face any ovarian pathologies later in life. Now, because ovaries are gone, these women do report decreased sexual pleasure after hysterectomy along with ovarian removal. We have seen that the problem is more in patients with perimenopausal age group and women who are less than 50 years of age. It's less common in women who are already menopause. A solution to this which we offer is hormonal replacement therapies. Now, because your body is not making hormones, we supplement it from outside, and there is some slight improvement in the sexual life after hormonal replacement therapy, but we have not seen very great results.
Maintaining sexual health after hysterectomy requires a holistic approach that considers physical recovery, emotional well-being, and proactive management of any changes in sexual function.